Today I'm talking about strategic exposure therapy, a treatment technique for OCD and anxiety. Hi, I'm Paige Pradko. Welcome to Therapy for a Better Life. So what would it mean for you to conquer your OCD and anxiety? Do you think you have what it takes? Do you think you know what you need to do to get better? Well, the main ingredient that you need to get better is determination. I learned this technique called strategic exposure therapy from Dr. Reed Wilson. He's been in the field of treating anxiety and OCD and training therapists and doing workshops for many years. In fact, he's written many books. I've seen him actually change his treatment techniques over the course of his career, and that's because he's really learned what works. And this is his current method, and I think it's a wonderful method. The first step in strategic exposure therapy is externalizing your OCD voice from your voice. If you were to see a video that I did on Pure O, Obsessive Thoughts, in that video I externalize OCD as a purple little monster, Gus. And I actually visualized, ourself as a stick figure. And in the video it shows that at first Gus was large and our little stick figure was small, and then we had a larger, stronger, louder voice. We became larger and stronger, and OCD became smaller and a smaller voice and just a little tiny monster Gus. I like that visualization of OCD, but externalizing it is very important. The step 2 is shifting your relationship with OCD and anxiety. So if you have OCD and anxiety, right now you probably don't want to have it, right? You're thinking, I have to get rid of this. Tell me what to do to get rid of this. And instead, I want you to change your relationship with OCD and anxiety. And instead, I want you to say, I want more of this. In fact, I want more anxiety. I want more uncertainty and doubt. I want more. I can tolerate this anxiety. I can tolerate this doubt. I can learn to handle this. Now, what we're doing in this method is we're actually pairing, when we have an obsessive thought and we get that anxiety from it, we're pairing that feeling of anxiety with a cognitive thought, a very helpful cognitive message of, I want more and I can tolerate it. I can handle it. Bring it on. I want more. And so every single time that we have an obsessive thought, at the same time, we're going to right away think, bring it on. I want more. I can handle it. I can tolerate it. And we're going to repeat that process over and over every single time that we have an obsessive thought or that we have anxiety. Now, what Dr. Wilson explains is that our particular theme of obsessive thoughts and OCD is not important. He is saying whatever your theme is, whether it's contamination or safety or responsibility for harm or fear of losing control, violence, sexual thoughts, harming thoughts, relationship thoughts, superstitious thoughts and numbers and repeating and thinking rituals, all of those themes don't matter. In fact, he just says he wants you to concentrate on the feeling of anxiety and the feeling of uncertainty. And the treatment method is all about handling and tolerating the uncertainty and the anxiety. It's not about the theme. So step 3 is we are going to do the opposite of what our OCD wants. Now, our OCD wants us to try not to have it, right? To try to resist it. And then to compulse or compulsive behaviors, trying to get rid of this anxiety. But we're going to do the opposite. we are going to feel that anxiety and we're going to say, bring it on. We want more. We can take it. We're going to take it. He describes it as take the hit of the anxiety. Bring it on, take the hit. And we're going to do nothing. We're just going to ask. All we're going to do is ask for more, and then we're going to do nothing. And we're going to repeat it over and over as many times as we possibly can in a day, hundreds if possible. Now in OCD, what's really happening is our prefrontal cortex is talking to our amygdala, the fear center, and we are scaring ourselves with OCD. We just continually try to scare ourselves. And so this is a paradoxical technique where we are actually not going to do what OCD wants, and we are going to do the opposite. We are going to ask for more uncertainty, more anxiety. And then the last step, step 4, is just going through our day looking for as many opportunities as possible to ask for more anxiety. Anytime you're feeling anxiety, anytime you have an obsessive thought and you're feeling that anxiety, you ask for more and then you do nothing. If you don't want to work on it on a particular time of your day, then you simply say to yourself, I'm choosing to not work on it right now. But every time that you can, ask for more, ask for more. Now, this is an exposure exercise, and you might want to know, why would it be considered an exposure exercise? Well, like regular exposure, we actually set a determined time that we're going to practice our exposures. And many times people don't have that time during the day to do that, and they're not practicing their exposures every day. So this is called a strategic method because we are continually practicing our exposures. Every time we have an obsessive thought, we're saying, there it is, there's that anxiety, there's that feeling of uncertainty, and I'm going to tolerate it. I'm going to welcome it. I want more. Every time we're going to do that. And so we're getting a lot of exposure experience through the day. There's a reason why Dr. Wilson changed to this method in his practice. Like every type of exposure, I just want to say that the same rules apply. There is no reassurance-seeking behavior. There's no safety behaviors of having other people with you or somehow they're part of the ritual in some way. We're going to avoid what I call avoidance behaviors. We're going to have no avoidance behaviors. We're going to, always doing that asking for more procedure. There's also no secondary gain. Secondary gain is when our brain gets some kind of benefit from having OCD. Maybe we say we can't work, or we can't be in a relationship, or we can't leave the house, or we can't be without this person by our side. Those are all secondary gains, and we don't want any of those behaviors with OCD. They all reinforce OCD. And also no benzodiazepines, because every exposure therapy taken with practice with a benzo is ineffective. Benzodiazepines make exposure ineffective. In fact, it makes all therapies ineffective. So you want to work with your doctor to get off of benzodiazepines if you happen to be on them right now. I hope that you learned something new about strategic exposure therapy today. It's one of my favorite techniques. And please leave me a comment about what you thought about the video. And please subscribe to the channel if you'd like to hear about different techniques and other mental health topics. So until next time, I will see you in session. Bye-bye.